12 ways to reduce your risks for stroke. Strokes don't usually occur with warning, and no one can foresee the exact time when a stroke will occur. Fortunately, there are ways to reduce your risk for stroke. While you can't change a genetic predisposition to stroke or your age, there are things you can change, including the following. Number 1. Quit smoking. Smoking is one of the major risk factors for having a stroke. Smoking increases the risk for stroke, and, if you are a cigarette smoker, you need to quit. Smoking causes blood clots in the brain and can increase your chances of having a stroke. 2. Drink less alcohol. If you are a drinker, you need to drink moderately. That means drinking no more than 2 drinks per day for men, and no more than 1 drink per day for women. It is not a good idea to drink even on weekends, even if you haven't had anything to drink for the past week. 3. Consume less salt. Decrease your sodium intake to no more than 2,300 milligrams per day. If you are over the age of 51, you need to decrease your sodium intake by no more than 1,500 milligrams per day. 4. Eat a healthy diet. You need to decrease your intake of cholesterol, total fat, and saturated fats. Unsaturated fats are okay to eat. You also need to eat less red meat and sugar. The mainstays of your diet should consist of nuts, seeds, beans, poultry, fish, whole grains, low-fat dairy products, fat-free dairy products, fruits, and vegetables. 5. Exercise. Exercise can help reduce the risk of stroke by improving the stamina of the heart and by improving your circulatory system. Exercise boosts HDL cholesterol, which takes cholesterol back to the liver, reducing your stroke risk. 6. Control your high blood pressure. You can reduce your stroke risk by helping your doctor manage your high blood pressure. You can also lower your cholesterol by eating fruits, vegetables, and eating a diet low in salt. If you already have high blood pressure, you need to take the medications prescribed by your doctor. 7. Reduce high cholesterol. Elevated cholesterol levels can cause fatty plaques to build up in your arteries, reducing their flow and increasing the chance that you will have a stroke. Elevated cholesterol levels cause atherosclerosis, which involves a lack of blood flow to the brain. Try diet and exercise first. However, if these don't work, you may need to take medications under your doctor's advice to control your high cholesterol levels. 8. Control atrial fibrillation. Atrial fibrillation is a major cause of stroke and often causes bigger strokes when compared to strokes from other causes. The doctor will treat atrial fibrillation with medications that can prevent blood clots from forming on the inactive wall of the atrium, thus decreasing the risk of embolic strokes. 9. Diabetes. Diabetes can increase your risk of stroke 4-fold. For those with type 1 diabetes, closely monitoring the blood sugar and insulin use will decrease your chances of having a stroke. Type 2 diabetics may need to take medication as per their doctor's advice and must exercise in order to reduce their risk of stroke. 10. Ride your bicycle 20 minutes per day. Researchers out of Germany studied 100 men who had angina or mild chest pain. They had some of them exercise on a stationary bicycle, while others had an angioplasty. Those who had the angioplasty had a high risk of stroke, while those who rode a bicycle didn't have a high risk of stroke. If you already have chest pain, you need to see your doctor before starting an exercise program. 11. Eat some dark chocolate several times per week. There have been many studies suggesting that eating dark chocolate can decrease the risk of stroke. It's the flavonoids in dark chocolate that are responsible for reducing the risk of stroke because they keep the arteries flexible. Other things about dark chocolate that reduce the risk of stroke are that it reduces blood clotting and keeps LDL cholesterol, the bad cholesterol, from clotting, making it less likely that you'll have a stroke. Number 12. You also need to consume daily Foods that keep your heart and blood vessels healthy. Some of these foods are cayenne pepper, beets, berries, fatty fish, pomegranates, garlic, walnuts, grapes, turmeric, spinach, citrus fruits, dark chocolate and ginger. Being overweight or obese increases your risk for stroke. To determine whether your weight is within a healthy range, doctors often calculate your body mass index (BMI). If found to be overweight, you should start a weight loss program under your doctor's supervision. Thanks for watching. Please like, share and subscribe.